It's 8:30 a.m. Appreciate everybody joining us, especially on such a beautiful April morning. Um, Great week we've had, and great week and weekend coming up. Possibly the busiest weekend ever in the Charleston metro area. Uh, as you know, we've got the Cooper River Bridge Run bringing in about 35,000 participants. Paul's told me it's the third largest 10K run in the country and the ninth largest running event anywhere in the United States, including all the all the marathons and all runs. It's the ninth overall, so a huge event for us. And of course, we got the world's best women's tennis players coming in town for the Credit One Open on Daniel Island. The Charleston River Dogs have got their opening night that's much anticipated. They'll play the Myrtle Beach Pelicans. It's going to be a huge fireworks show over the Ashley River Friday night. Should be a great time. Of course, Somerville has their Flower Town Festival. The Strawberry Festival's going on Mount Pleasant. The Harlem Globetrotters are in town. A lot of activities to get out and go and see things. If you go to Charleston CVB website, you just keep on scrolling with all the events. But what a great weekend we have coming up, and I appreciate everybody taking an hour out of your time this morning to be on this call for our Health and Wellness Advisory Committee. We're going to defer the minutes on here. We just needed to tweak a few things, so we'll get those. We will approve those minutes at our next meeting. So I'm going to move right on down the agenda to item number 3, which is creating a culture of movement, local efforts to boost physical activity. We've got Dr. Morgan Huey, Associate Professor of Public Health with the College of Charleston, and I'll turn it over to her now.
Hi, everyone. I'm going to work on share my screen. Paul, give me a nod. You can see my presentation.
I can see it.
Okay, awesome. Paul, thanks for inviting me. And as always, it's good to be with this group of like-minded and health-focused folks in the community. Councilman Shealy, thanks for the overview. We do have a big weekend, and I feel like this month of April is just such a good time to talk about physical activity, which is the focus of my research. So that's what I'm gonna do today. Talk a little bit about the bridge run and some light preparation recommendations, an overview of physical activity, just so we're all on the same page, and just some high-level insights from some of the research that I've done, and kind of some action steps, like what can we do with that information that we know. So for the next 15 minutes or so, I'm going to share a little bit about that. As Councilman Shealy said, this is a huge weekend for the city of Charleston and town of Mount Pleasant, as about Paul, what did you say? How many registrations?
We're just over 34,000 at the moment.
Yeah. And then friends and family, and so as thousands and thousands of people come to the city, this generates about 35 million for the Charleston economy, and overall the race being the third largest 10K in the United States, a big part of the mission is to promote lifelong physical activity. And so it's something that a lot of people do for the first time, train for, and definitely see a lot of folks getting active in our community. So I'm not going to provide a training plan if you haven't been training. Maybe focus on your walking speed for the weekend, walking or running. Any kind of movement is good for the race. And so just encourage folks to mostly have fun. But as you're preparing, and really focus on getting good sleep each day this week, and good rest. Hydrating each day, so not just the day before, but really focusing on getting good water intake throughout the week, and having some water when you wake up the morning of the race, kind of to ease some of the stress and anxiety that may come along with the race. Knowing what you want to wear, laying out your gear, and knowing your transportation plan can really help that morning go smoothly and ease any stress. And then the other thing I would recommend is a familiar breakfast. So you don't have to just not eating something that's really different for you, so that your belly is used to what you're having. Again, having that water. And when you're getting ready for the race, I encourage both static stretching, so stretching those calves and hamstrings, but also doing a little dynamic warm up. So jogging a little bit, doing skips or hops, to get the blood flow going as you're getting ready for the race. So, but mostly have fun, enjoy the views. It's one of the best views in the city to see the water and to come over to the city of Charleston and then celebrate in our wonderful city. So this was me in 2019. That was the first time I did the bridge run. And I wanted to share a little bit, not just about the physical activity portion. And so I know everyone will be going over all lanes of the Ravenel Bridge this weekend as it's shut down for the race. But I wanted to highlight the bicycle and pedestrian access because we're 20 years. The Ravenel Bridge opened in 2005, and so we're 20 years from the opening of that new bridge. And many of you probably know, or maybe you've experienced, I definitely have. I love this resource that we have in our community, that there's a standalone bicycle and pedestrian access from on the bridge from the city to Mount Pleasant. But maybe you didn't know that was not an original design for the bridge when the Ravenel Bridge design was proposed. And so I wanted to highlight that a coalition of partners and organizations, including the Sierra Club, Coastal Conservation League, Community Health Partners, and at the time they were called the Community Bicycle Advisory Group, launched this pre-supposition campaign. So they created, so this was 20 years ago in around 2005. They had these postcards that are shown on the slide and t-shirts, and they really flooded Town Hall. At the time, it was Mayor Riley and Honorable and Cheryl Woods Flowers in town of Mount Pleasant. So flooded their office with these postcards and messages that people wanted to be able to walk and bike the bridge. It was a successful campaign, and bicycle and pedestrian access was added. And I know many of us are very, very glad that it was. And that officially launched the start of an organization called Charleston Moves. So there was an advocacy group then, but this was the official start of the nonprofit. I'm on the board for Charleston Moves, the nonprofit. I have been for a couple of years. And it's a nonprofit advocacy group that advocates for safe spaces to walk, bike, and take transit, and just to make it more easily accessible in our community. And May, so coming up next month, is Mobility Month. And so really just highlighting the success that we've had in the region, other projects that are coming up, and just to celebrate walking, biking, and taking transit. This year is the 20th anniversary of our organization, and so we have a couple of extra events, and you'll see these. I love our logos this year. Hopefully you do too. I have the link to these. These are all free. There's donations suggested if you know folks are able to do that, but there's 2 bike rides. We have a 20th anniversary bike ride on May 1st, and that'll be it's on the peninsula. It starts at Island Cabana Bar, kind of near the base of the Ravenel Bridge. It'll go throughout the peninsula over to the Ashley Riverside and back. That's a police escorted ride as well, for folks that might be concerned about safety. Similar for the Ride of Silence, it'll start at Palmetto Brewing. It's a police escorted ride. And so you do have to sign up for those, but they are free to participate. We have a history lecture about what's under the streets of Charleston. I'm really excited about that this year, kind of digging literally underneath the streets. Bike to Work Day celebrations at 2 local businesses, and then a Light the Night, a free bike light giveaway in North Charleston, partnering with Mount Moriah Baptist Church. So please join us, please share this. We want to get the word out and have folks that are interested in this participate. Moving forward, I just want to talk a little bit about physical activity and public health. So that's really what I've studied, and one thing I'm just really passionate about is promoting active people in active communities. And so I know I'm probably preaching to the choir, but the benefits of physical activity are vast. You can see this graphic from the Centers for Disease Control and Prevention. And so regular physical activity has immediate impacts, long-term impacts, and can really positively impact our brain health, our heart health, our bone health, our mental health, so many different facets. And so it can help reduce the risk or reduce the severity of most of our leading causes of death in the US. So promoting physical activity for everyone is really, really important and can have a lot of benefits. We have national guidelines for physical activity. So for youth, it's 60 minutes of aerobic activity or movement that gets your heart rate up each day. So moderate intensity, I always think of and say it's where you can, your heart rate's up like a brisk walk, you can talk, but and say full sentences. You're talking with someone, but your heart rate is up. Vigorous activity, more like jogging. Your heart is really pounding pretty good. You can say a few words, but not full sentences. So kind of just differentiating there. So kids need about an hour a day throughout the day. And then adults need at least 150 minutes per week. So I often think about that as 30 minutes, 5 days a week for moderate, or 75 minutes of vigorous activity. Also, muscle strengthening activities 2 days per week is recommended. But I like to focus on this bottom message, the public health message. Anything is better than nothing. So we sit a lot, so taking movement breaks, going for short walks, even if you don't have that 30 minutes, any kind of movement is better than none. 30 minutes can really help folks get a substantial health benefit. So we really have a problem with physical inactivity in the US. Only 1 in 5 adolescents meet guidelines, and only 1 in 4 adults meet those guidelines that I just presented on. You can see 2 maps here that I pulled of where South Carolina is. We're not in the, we're not in the top tier of the worst, but we're right under. And so for adults, this first map on the left, about 30% of South Carolinians report no physical activity. So no moderate or vigorous each week. And we have about 32% of our adult population classified as obese. So we have work to do. I wanted to highlight one other data source in our last iteration of the Tri-County Community Health Needs Assessment. Obesity, nutrition, and physical activity was in the top 3 ranked concerns for folks in our region in Berkeley, Charleston, and Dorchester County. So we see the data from national sources, and we also hear folks locally saying this is an issue, something that we need to do something about. So what can we do? So Charleston really does have a lot of opportunities, kind of starting with programs and events. We're highlighting the Bridge Run today and all the work that goes into that, and just that mission of promoting lifelong physical activity. There's runs on our islands, Isle of Palm, Kiowa. We have the Charleston Half Marathon, which is another big road race, the Turkey Trot and Reindeer Run. So some of these fun activities to get folks out and moving. We have organized sports through both our city departments and private organizations, and for both kids and adults. And certainly we have a number of gyms. So some of these are low cost, but for a lot of folks, any cost is prohibitive. For some folks, races, going to a gym and doing a workout is intimidating. And so one thing that I like to focus on is making sure we provide those opportunities for folks to be active on a daily basis in a way that's comfortable for them, and can support the training for these runs and activities as well. So again, probably preaching to the choir, but the environments, the practices of the places and the organizations where we live, work, play, study, and pray can really shape our health. So do we have safe opportunities to get out and go for a walk? What kind of foods are served at our work, or do we have access to nutritious foods as well? And so just knowing that it's not just, does someone want to wake up and go for a run in the morning? Well, do they have the spaces and places to do that if they want to? And do they also have the knowledge about how to do that safely for their bodies as well? So I highlight here we can transform spaces and communities to really get people moving. And the title of my presentation was creating a culture of movement. And so I really think creating parks and playgrounds and safe streets are ways to change that culture, to make it easy for folks on a regular basis. So this is St. Julian Divine Community Center downtown on the east side. A pretty recent playground renovation, just showing we can take a space, get community input, transform it for folks, and in this case, kids, to be really active on a regular basis. And so for the next couple of slides, just kind of highlighting some of my research that supports some of these ideas that I've shared. And so starting on the left, a study with about 10,000 children in Greenville County, South Carolina. I found that less obesogenic environments, so neighborhoods where kids had better walkability, access to parks, and access to healthy foods were related to a lower risk of obesity. And so I have the citations for all of these as well, and happy to answer questions about these. In another study that I was a part of, we collected data on adults in 4 U.S. cities, including Greenville, South Carolina, Raleigh, Brooklyn, New York, and Seattle, Washington. And in that study, we saw that folks that had neighborhood parks and used them were much more likely to meet the regular physical activity recommendations. So having those spaces is really, really important for folks to be regularly active. And also the design of parks and playgrounds can increase usage and increase physical activity, particularly for kids. So I've done a few pre-post studies about park and playground renovations and I've seen that activity and usage can really go up. Policies are also important. So this stemmed from research I started when I was an undergrad at Furman University in the upstate, but it was a longitudinal study with elementary age kids, and we followed a group, and we saw that over time, if kids had daily physical education, they had better cognitive outcomes and physical fitness outcomes than a group of other kids that only had PE 1 day a week. So having that policy requiring that daily movement for kids was a big factor in this population for improving health. And then recently, in the past couple of years, I've worked with a national nonprofit called the Trust for Public Land to develop a framework about how cities are increasing access to parks and green space. So we call it the Park Access Framework. And so the Trust for Public Land has cities try to sign on to getting everyone or a certain percentage of residents within a 10-minute walk of a park. And so we've been studying the policies that can help cities get to that. So for example, some cities have community engagement policies that require a certain level of community input. Others have public finance policies. We've actually passed one recently in the city with a bond agreement specifically for parks and recreation for our city department. And other folks also have policies for land use and development, particularly geared towards developers. So those have been important. I interviewed city leaders from about 25 cities, and they said the funding and the land use were the most important for their cities to increase their green space that they have for residents. And then good practices are really important too. So 2 student-led studies here at the College of Charleston have studied our bike share program and shown that folks that use the bike share are more likely to meet physical activity recommendations. And one student studied also the difference between our e-bikes and our regular bikes. And so our e-bikes here in the city are pedal assist. So you pedal, it does help you out some, but you do have to be pedaling. And so there was still moderate level physical activity with our e-bikes. Certainly folks get more activity with the regular bikes, but we also found that people enjoyed riding the e-bikes more when we did our study. Engaging communities, what do they want to see in their parks, their playgrounds, is really important and can lead to that greater usage and physical activity. And then again, I have a picture here of the Ashley River Crossing, which broke ground in January. So this is a really large and expensive project, but prioritizing safe places for people to be able to get around is really important for creating that culture of movement and health, just trying to make it easier, making it safe as possible for people to move for transport, move, to run an errand. Maybe not every errand, but maybe to go to the store every once in a while, or to go see a friend, to be able to walk or bike there. That's a way we can engineer movement back into our days, rather than sitting all the time. So what can we do? We're a group of folks, that gather each month to learn about these topics, but I think we have a responsibility to continue to promote these and improve our communities. I think one is leading by example, and just prioritizing some movement in our own daily lives, sharing this message. One thing that is very consistent in the research is that if people enjoy the physical activity that they're doing, they're much more likely to do it. So encouraging folks, whether it's a sport, it's pickleball, it's walking. Walking is the most common form of physical activity. Whatever people enjoy, that's what they're most likely to do. So that's a message we can share with folks pretty easily. I think we can continue to support through awareness, through volunteering, through getting involved with local organizations. So our city department, city parks and recreation, city transportation, other departments that are supporting this work and the infrastructure of our city. I shared Charleston Moves. We have the Parks Conservancy that supports city parks. Keep Charleston Beautiful that helps keep our spaces clean. And there's a number of local recreation organizations, different running groups for different sports that promote this lifelong physical activity. And then lastly, I think really communicating with our leaders and our elected officials to let them know we do care about this, and care about certain projects. So our city councils, county councils, neighborhood associations, school leaders and PTAs, leaders of churches, and our Department of Public Health. And so if we don't share that we care about this, or this is important, why it's important, and the data around it, we can't expect those folks to know. And so I think communicating with them and also really thanking them when the work is getting done and acknowledging those decisions that they make that can positively influence our health. It does take a collective to change that culture. So this is an image from the Surgeon General's Step It Up campaign now over 10 years ago. But it shows that if we want the Step It Up campaign was just to promote walking because it is the most common form of physical activity. It takes everyone. So from employers and work sites to parks and recreation, cities, schools, healthcare, and public health. Everyone can have a role to promote daily movement and have a culture of fun too. It should be fun. It should be playful. That's what we want our kids to do, right? We can lose that as adults sometimes, but I think it's really important to continue to promote that. But active communities will be healthy communities. It's good for it's good for individuals' bottom line. It's good for cities' bottom line. It's good for well-being. So I appreciate everyone's time. I'm happy to answer any questions about the data I presented. I'll share this with Paul to share widely, and feel free to email me anytime. I can answer any questions or support physical activity related initiatives.
Great presentation. Thank you very much. Any questions? Well, thank you so much, Dr. Morgan Huey, for sharing all of that. We very much appreciate that information. That was a very, very good presentation. So thank you. All right. Yes, Paul.
One thing I think what Morgan shared, things we can do. I mean, maybe it is time that we did something for health and wellness to look at how we are affecting movement in our community by getting groups out there, trying to talk this a little bit more of doing some PSAs, maybe through city council and through our neighborhood associations about movement. And I'm sure that Morgan and her and her group and Kimbo with the Citadel and public health with the Katie and everybody else, we've got a good group of experts out there that can help in this charge. But maybe that's a good thing we focus on in May, June, and July is how can we affect movement in our city for our citizens.
Okay, very good. Yeah.
And I also put in the chat, I don't know whether you saw it, when she showed the sign of St. Julian Divine Community Center. I don't know if y'all realize there used to be a road that came in front of where that playground is, and it went up to the second floor. And all the garbage trucks would drive up there, dump their trash, and it'd come down in those two big smokestacks.
Yeah.
They would burn all of the trash, which think about all the pollutants we put into the community way back then. But to think that the facility is damaging as that is now building peace and creating activity for our children right there in the heart of that community. So,
yeah. Well, it was very exciting to come across the Ashley River the other day and see those cranes working on that Ashley River crossing. It's pretty exciting. So, very good.
I think we're going to see so much. I've had students out and do observations and counts on the Ravenel Bridge and on the West Ashley Greenway. I think we're just going to see so many people coming across that bridge here in a few years. It's very exciting.
It is. So, a lot of collaboration went into making that happen. So yeah. So all right. I did want to mention Dr. Kay Durst sent her apologies. She'll plan on being here next week. Couldn't be here. Nick Osborne with the Low Country Food Bank. He had an accreditation, I think, that he needed to take care of, so it was not able to be here, and he sent his apologies as well. I do want to thank Dr. Katie Richardson for inviting Jameen Shaw, I hope I pronounced that right, and also Luisa Ramirez. Jameen Shaw is a first-year medical student at MUSC. He's very interested in public health, and we're happy to have you. And also Luisa Ramirez, she's the director of Tri-County SHAPE Initiative. She works with Dr. Richardson, and she's also, I think, going to discuss a little bit about SHAPE's annual report. But without holding up anymore, I will kind of turn it over to Dr. Richardson, if you would, please.
Thank you. Morgan, I just want to second or third. That was a great presentation. And certainly the Department of Public Health is very fortunate to have Charleston Moves here in this area, as well as a very strong Parks and Recreation Department. And we are here to partner at any time. So Luisa Ramirez just came on camera. She, as Councilman Shealy said, she is a health educator with our community engagement team here in the Charleston area and the director of our Tri-County SHAPE. And I asked her to come because we recently had our biannual meeting and she prepared an annual report for that meeting. And I asked if she would share it with this group, and I will share it with Paul so that he can send it out with the minutes as well. So Luisa?
Awesome. Thanks for having me here. And thank you for that introduction, Dr. Katie. Yeah, so I'm here to share a little bit more about Tri-County SHAPE. So for those who may not be familiar, SHAPE stands for Sexual Health Awareness, STI Prevention, and Education. So kind of our collaborative effort to support our Fast Track City initiative for the city of Charleston. If you're not familiar with Fast Track City, just like a very brief overview, it's a global partnership between different cities and municipalities that are striving to achieve the 95-95-95 goals, which very briefly as well aims to reach 95% of people living with HIV that are knowing their status, and then 95 of those people being receiving treatment, and then 95% of the people in treatment to be virally suppressed so that they are not able to transmit HIV to others. And so with Tri-County Shape, we try to uphold different events or talks or just community opportunities for people to be aware of their HIV and STI status. And with that, I will just share my screen real quick. All right. And then just to briefly kind of go over, probably won't share too much or everything, but this will go out as well, our Tri-County Shape annual report. And so we are a nonprofit, a 501c3, so we were able to use that to be able to reach out to businesses and different coalitions to support and uplift our events. So this is our annual report for 2024, and we'll just kind of go over some of the things that we were able to accomplish and provide for our community. So just as a general overview, we did have like more than 15 SHAPE meetings. We do have 2 different work groups within our SHAPE initiative. So our communications and outreach team, which kind of is focused on that community facing an event hosting effort, and then our clinical and surveillance team, which kind of is like the background work, dealing with the Fast Track City initiative data and other clinical updates that are essential for people working in the STI HIV kind of realm within our Tri-County area. We hosted 3 different community events, and overall we're able to reach more than 200 people at our events. It gets kind of difficult to capture the precise numbers, but as a general collective number, able to reach more than 200 people. 1 training for parents, 2 training for youth serving professionals, 1 which was held at or which was given at a statewide conference, and then 1 training for youth. And so just to go over kind of our big projects, our strong involvement with the local pride chambers, and then Project Condom. Project Condom, for those who may not know, is our really fun event where we get community teams. We had about 10 this year, create a costume following a theme. Our 2024 theme was Once Upon a Condom, so kind of like fairy tales and mythical legends surrounding that. So I think this is Dorothy from Wizard of Oz, entirely out of condoms. And so teams are able to kind of cut them up or place them in different patterns to create a costume of some sort. In addition to Project Condom, we were also able to walk in the Pride Parade and then set up many tables and help kind of educate the community during the different Pride events. And we also look forward to being involved and participating in Pride this upcoming year as well. And then on the later half of the year, our World AIDS Day celebration, which did take place on December 1st, which is official World AIDS Day. Tri-County Shape was able to partner with Charleston Black Pride, whose mission is to educate, inspire, improve, and celebrate the experiences of LGBTQ+ people of color. Them, as well as Potluck in the Park, who provides meals and clothing to people in need at the park at the corner of Columbus and America Street. And so they're actually there, I believe, every weekend or just about. And so we were able to kind of all collaborate together and put up a really great successful event. We had a calling of names to remember those who we've lost to HIV, as well as Narcan and a safe sex kit like distribution, in addition to the music and food and clothing that were able to be collected by the people that may visit. And then just to recap some of those other smaller projects that happened throughout the year, the Sex, Substances, and Social Media, which is a talk aimed towards parents and caregivers of youth and adolescents. This was the talk that was held twice throughout the year, 1 virtually and then 1 at a conference, just to kind of give parents an idea of what's normal, what is common or trending nowadays between the relationship in sex, substances, and social media. So how those kind of all intersect and what's important to know, as well as the Charleston County School District sex ed teacher training. So we were able to go in with teachers from Charleston County School District that are going to be teaching sex ed to, I believe this is the high schoolers, and kind of just update them in similar context to the sex, substance, and social media, just things that are trendy, language that's being used today, common myths and things to look out for when you're teaching sex education to young people. And then similarly, our We Are Family collaboration with their leadership camp, we were able to go in and kind of give people, kids that may identify within the LGBTQ plus community, just like a sex ed course that may be a little more tailored to their sexual practices as opposed to what they may receive in school. And that's pretty much everything that I think I'll go over. We're able to do a marketing campaign as well. And so this is just kind of an overview of the number of people. It's kind of hard to see the numbers, but the number of people that are seeing and receiving an STI testing ad on their phone. And so the number of impressions, overall impressions in both English and Spanish this was adults ages 18 to 34, I believe. The number of times it was then viewed and the number of times that it was actually clicked on. So these banners said things like, do you have a regular provider? This is where you can get free or low cost. And then it then took them to the Department of Public Health landing page to schedule an appointment. So we have about 6,000 people in the Low Country area, which the Department of Public Health, these are our Low Country region counties, all the way from like Allendale down to Jasper, and then back up to Charleston, that are interested or in need of just finding out more about where they can receive STI testing. And then I do believe that is all I did want to share. In addition to that, we're just staying on top of our Fast Track City data. And so recently updated the hepatitis C data to include data from 2023. And we're looking forward to including more data from 2024 as it comes out and is published. But I want to thank you all for having me, and I will be sure to send out the annual report and the other information as well.
Thank you, Louisa. Appreciate that. Any questions, comments? Thank you very much for that report. I appreciate it. Thank you. I'll turn it back over to Dr. Richardson.
Thank you. Appreciate you coming, Louisa. Just to piggyback off of that, our next free testing day for STIs and HIV is April the 10th. It's in honor of STI Awareness Month, and appointments can be made through the Department of Public Health appointment line at 855-472-3432. We will accommodate walk-ins when possible, but we do encourage appointments. And everything that Louisa talked about and Tri-County SHAPE works on is so important because I just wanted to share a little bit of data that just came out that Charleston is now ranked 46 for the top 100 U.S. cities for rates of STIs. And we actually rose, so we went in the wrong direction. From last year to this year, we were 52, and now we are 46. The Department of Public Health was able to go to College of Charleston on the 19th of March and provide no cost STI and HIV testing to almost 80 students. We really appreciate that partnership and have done that in the past as well. So just moving on from HIV and STIs, Thankfully, flu has dropped from widespread to regional activity now. We are not seeing a lot of influenza-like activity or illness at this point in time. COVID rates did rise slightly, but they have now started decreasing again with our wastewater surveillance. So one of our sites is the Charleston I think it's the Plum Island site where wastewater is tested for a number of respiratory infections, including COVID, flu, and RSV. So thankfully, those numbers are going down now. Still, a COVID vaccine is not necessarily recommended for everyone, but is available for those ages 65 and over, as well as those with other chronic medical conditions. So if you have one in the fall and feel like you're in a high-risk group, please talk to your provider about whether another COVID vaccine would be recommended at this time. Yesterday, the drug overdose death report for 2023 came out with the Department of Public Health. Unfortunately, we did see an increase in overdose deaths in Charleston. We did see 255 overdose deaths. In 2023, 227 of those were from prescription drugs, 204 opioids. That was an increase of 16% over 2022 and an increase of 17% for opioid specific overdoses, much of that fentanyl. Charleston County has been doing a lot of innovative things to make sure that we're capturing drug overdose deaths. So maybe Jennifer has some more thoughts she wants to share, but I think some of this increase is probably just by diagnosing or contributing more of these deaths to opioids or to drug overdoses, because the state as a whole did see a decrease. So I want to make sure that I'm giving credit to many partners who are working very hard to get Narcan out in the community, and to the coroner in particular to really think of a drug overdose death as a possibility, make sure they're testing for that and then reporting that in our county. And then finally, Paul sent out a number of events that the Department of Public Health and the community engagement team that Louise is a part of will be participating in coming up this month. And these will be open to the public. Chicora Elementary is having a community resource night on April the 9th. Thank you for pulling that up. On April the 12th, there'll be an Extending Branches event at the Berkeley Electric Co-op on Johns Island from 1 to 4 p.m. There's a focus there on the unsheltered and low-income community, but everyone is welcome. There'll be resources around housing, food, COVID vaccines, resources for pets, and more. On the 26th of April, there will be a community health and wellness fair at St. James Bethel AME Church on Wadmalaw Island. That will be from 9 to 1. And finally, there'll be 2 conferences, both in Columbia, on April 29th for middle school students and April 30th for high school students, around vaping and advocacy. These conferences are planned by teens, for teens. They'll be from 8:30 to 3:30. Lunch will be included. There's no cost for attending, and there is reimbursement for schools for travel expenses. And so I wanted to make sure that I shared those resources. I don't think Maggie is on, but make sure that our schools know that that's a resource. It's certainly a big public health problem. So I think I'll stop there. Happy to take any questions. And as always, thank you for having me.
Any questions, Paul?
Katie, and I know I just sent you a chat on it, but I can sense that there's going to be a lot of federal cuts coming to public health and substance abuse, et cetera. How is that going to affect, or what can we do in the interim to try to help be advocates or whatever we can do to try to help y'all with that?
Thank you for that question. Yes, late last week, we were notified by the federal government that all remaining COVID funds are being taken back by the federal government. So that will result in the loss of over 60 personnel with the Department of Public Health. And while thankfully COVID has improved, it's still around, and we were really using those funds to bolster our ability to address a variety of public health issues, get ready for the next outbreak, and beef up our surveillance. So that will be something that we have to adjust to and reorganize. But the work of public health goes on, and so we will figure out a way to do the work with less people. And so yes, I just appreciate this committee and having a community of those who really value public health. And so we may be leaning on you a little bit more in the coming months. But thank you for the work that you do in helping us get the word out.
And any updates on measles in our area at all in the state?
Thankfully, we have not had a case of measles in South Carolina yet. There are definitely still new cases across the country. So we are getting a number of families who have children between the ages of 6 and 12 months who will be traveling, who are looking for an MMR vaccine. We are offering those vaccines. The child must be at least 6 months old, and it does not replace one of the 2 MMR vaccines needed, one at 12 months and one at 4 years of age. But there can be that additional vaccine for those who may be traveling on planes or trains, going abroad, or going to one of the states that is having measles cases right now. So we're certainly encouraging those who are unvaccinated or under-vaccinated for MMR to seek that vaccine, and are offering it for infants who may be at risk.
And then Kevin, I just want to add that as a doctor of medicine, I did witness Dr. Richardson practicing what she preaches. And I saw her out running in the morning. So I know she's exercising every chance she gets.
Very good. Very good.
Thank you, everyone.
Dr. Richardson, let me just ask you real quick, because you mentioned real quickly the overdose of prescription medications. Are those are just accidental, didn't realize, or do we know on those?
Right. So almost all of these are accidental deaths. Part of the report does look at suicide versus unintentional overdoses, and the vast majority are unintentional. And what this is, they say prescription medications, but it's not the kind of prescription that's called into CVS and you pick up. These are still pills bought generally on the street that are laced with fentanyl. So folks think that they're taking something that does not have fentanyl, that they will be able to tolerate. And in fact, it's mixed with more potent opioids. And so that's how it's saying it's not heroin, basically, and so it's saying it is more similar to prescription medications, but they've been tampered with.
Okay, gotcha. Thank you. All right. All right, if no other questions, Jennifer Brush, do you have anything that you'd like to add for us today?
Yeah, good morning, everyone. I think we must have named 50 events that we're doing. What a great place to live, right?
Yeah.
I mean, this is just amazing. And this weekend, I know, Paul, you've probably been just so busy and not sleeping, getting ready for the Giant Bridge Run. And we're going to be part of that at the expo. We're going to have our 988 team out there with a table. And We also have I think for the maybe 12th year in a row, we have our walking group of patients from Dorchester that have done the bridge run every single year, and they make t-shirts and everything, and they're very excited. So we'll be out there for that. Let's see what else is happening. This past weekend, RPM Events put on a really fancy car show at the Coliseum in North Charleston Performing Arts Center. And due to a suicide in one of their families, a brother-in-law, the guy who put it on, he died by suicide a few years ago. And he does these events around the country and picks nonprofits to give the money to, and they chose to give it to 988 South Carolina. So we were out at a car show, which I've actually never been to a car show. It was actually pretty amazing. But that was just really sweet, and we were just so happy to have people think about 988 as we try to get the word out. I was manning the table, and everybody that came up, I'd ask, do you know what 988 is? And, not one person knew what 988 was. So we still need your help spreading that word about 988 that you can call, text, or chat. But I feel for Nick going through an accreditation. We just had our accreditation survey for our 988 call center, our mobile crisis call center, and our mobile crisis team on Friday. And I can say, they don't ever tell you immediately if you're accredited, but they were very impressed with our coordination with all of those entities and our local 911 and EMS, how we work together to help people out in the community, whether it's in person or with telehealth. So that was exciting, and glad to have that part over. But they were pretty impressed, and so good news for us for that. I can't not mention the conference. Obviously, Paul won't let me not mention the conference. The Low Country Mental Health Conference is just a few months away now. It's in July 30th through August 1st at the Gilliard Auditorium. And I'll send it to you again, Paul. You can send out flyers to people. We have a bunch of great speakers for 2.5 days again this year, and we're really looking forward to that. And as far as funding goes, I feel for you, Katie. I know we lost some money at the Department of Mental Health as well, including American Rescue Plan Act funding. So I guess what we can ask everyone to do is just try to support not taking away from healthcare because all of the cuts that are happening, they're going to affect healthcare. They're going to affect patient care. They're going to affect our communities. And, we're all going to do the best we can to keep providing services at the level we've been providing services. But thank y'all.
All right. Thank you, Jennifer. Appreciate that. Thank you for all that you do and you continue to do. Appreciate it. That's, all right. Anyone else have anything that they'd like to bring forward during this meeting? Well, just want to say thank you again. Appreciate your time, your expertise, and thank you for making the city of Charleston healthier by participating in this, and and all that each of you do. We really, really appreciate it. And if there's nothing else to come before this committee, we stand adjourned. Thank you. Get out and enjoy it this weekend.